welcome back. I am Jason Salyer. This last weekend I took a wilderness medicine course that would help prepare me for emergencies in the field, whether that be everything from a sucking chest wound to a bleeding femoral artery, and tactics and techniques on how to handle those situations. And that's something that I was really lacking on. I had a little bit of knowledge. I've done a lot of first aid kind of boo-boo type training, but when it comes to really severe life or death situations, my training was very minimal, and I think that was something that I needed to get caught up on and get more familiar with. The course was great, and I'll be showing you in the video just one of the scenarios that we went through, kind of walking up to a person that's in dire need of some help, and you just kind of have to figure out on the fly and use whatever medical kit that you might have on hand to solve that problem. So enjoy, thanks for watching guys, and we'll see you next time. Blood going on here.
And yes, we're at home.
Oh yeah, we got a chest wound for sure. Did you get hit in the head at all? Have you passed out?
No.
Nothing like that?
No head injuries.
No head injuries, okay. What's his rate, heart rate?
Heart rate is 120.
Heart rate's 120, okay, so it's
4 seconds.
4 seconds. So we're losing some blood on the leg here. Is this like gushing blood? What's going on here?
Take a look, man.
Okay. So he's bleeding a lot. All right, we need to get some pressure on this because there's lots of blood happening. Let's maybe use that without tourniqueting it, unless this gets worse. I'm gonna push this on here, big guy.
Huh?
I want you to hold your hand on top of it.
Not working.
It's not working. Okay, not working. He's breathing. You all right, buddy? You having trouble breathing? Yeah, having trouble breathing. Is that gone now? Gone now. So that blood's controlled. I noticed he's got a gunshot wound in his chest. So I need to feel the back, see if there's any other holes in him. Anything back here?
None noted.
Nothing there. So I see there's a hole here. So I need to make a chest seal.
Good.
All right. I'm gonna take this.
Make it.
Let's get you laying down here, big guy, so I can work on you. Here, sock, clean it off. Take this here. Take this here. His heart rate.
120 still.
So that's not changing. Alright, so let's say I got this sealed off here. I've taken care of the sucking chest wound. Here, big guy, just keep that open for me. Keep your head there and stationary for me. You having a hard time breathing?
Hard.
Yeah, he's having a hard time breathing, so I'm maintaining the airway. Let's see, what else can I do? I've stopped this bleeding. I've maintained that, or I've addressed that issue. What else can I do?
Respiration's 8.
Respiration is 8, so respiration is going downhill fast. I can keep his airway open. I can keep him as comfortable as possible. I did the head, chin, lift, tilt.
Not helping.
Not helping, okay? So I just need to be getting ready to do something else. And in my kit... Okay, big guy.
There you go.
Let's get serious. Let's get serious. Okay, so
6.
So this is all I've got, and I'm going to maintain his airway as best as I can. Right. But if it starts to get real south, then I could possibly break this thing open to create a tube.
You see a little bit of jugular vein distension even through those caps.
Oh, okay. So I see jugular veins are bulging out.
Not crazy, but they're starting to.
But the esophagus is still straight.
Trachea is still midline.
Okay, so I'm just going to maintain this thing as best as I can until something changes. I can keep assessing pulse.
Okay, EMS has been called, but they are a quarter mile away because they are told to stage there until the stage is clean, right?
Okay.
Seen as safe.
Until it's safe. Which it's not.
No.
Okay.
You risked your life.
So I need to keep a lookout.
And that's what he's always looking for is...
He's got his head on a swivel, okay.
He does, he's looking...
All right, so I'm checking his pulse.
Somebody hasn't finished the job yet.
What's that?
Somebody hasn't finished the job yet.
Okay.
Terminating
so there
his
might
life.
still be trouble around.
Yes.
Okay, so I'm keeping head on a swivel and I'm just checking his rate, monitoring him the whole time, right?
Respiratory rate is 4.
So he's still dropping, but he's still breathing.
He's still breathing. Yes.
So I'm not going to be doing anything crazy yet.
Not yet.
But I could be prepping in case that happens.
Okay.
So I could break my pen here.
Yep. Okay, good.
Maybe.
I just want you to be thinking through it, right? Okay. Trachea is moving off midline.
Okay. Trachea is moving off midline, so that's a bad thing. So I'm going to listen and see what's going on with his chest.
You hear
What
good there.
What's that?
You hear breath sounds there and it's moving.
What about on the other side?
Diminished.
Really diminished on the other side. I can do. Can you say 99 for me? Okay, so I hear some problems in this section. How about the? How about that?
All air,
All air.
which is hyperresonance, right? All air.
Yeah. All air here. Same thing.
No, you get few lungs over there. So his right side is in good shape. His left side, even though it's a sucking chest wound, the injury went through to the lung.
Okay.
Okay, so his lung is collapsed.
This lung is collapsed.
He's still breathing,
Yeah.
which means what's happening?
So this is filling up with air, but
Pushing it.
and pushing everything this direction,
That's right.
putting pressure on the
Which way
heart.
did you see the trachea move?
It would be moving this direction.
Correct, which it is.
Yeah. So in this situation, if I see that happening, I know he's about to die.
Okay, good.
So I've only got a couple minutes to relieve the pressure on this side.
Correct. All right. Now let's stop right there for a second. Okay. Before you start going crazy with that, what does he already have?
He's got a hole.
So use it,
Yeah. Why is that not?
because it's not working. What you did was not working.
Okay.
So you did a procedure, but it didn't solve.
So
the
I should
problem.
probably just
There
do
you go,
that.
and stuff the pen down the hole.
and then give him a more opening.
Yes, that's right. That's correct. Because what it really was, or you thought it was just tissue damage, but it actually was deep enough that it penetrated and punctured the lung.
Okay.
Even though it was not obvious initially.
Gotcha.
Okay, continue on.
Okay. So I've jabbed this in here, and now I hear
Right through the hole.
yeah, right through the hole.
Yep.
And I hear
Good.
air.
Good. Now his respirations is 4.
Respiration's 4. So it's
Okay.
stayed the same,
Yeah,
getting better.
So it's not good, but it's not getting worse.
Okay. And I know EMS is close, but
Yeah, they're close, but SO hasn't been here to clear the scene yet.
okay. So I'm still just trying to maintain his airway.
Okay, the
Yeah.
scene is safe.
Okay.
EMS is here.
Got it.
So Robert and I are EMS crew. We show up. Hey man, what's up? What happened?
So this
Give me a
guy's
report. Give me a
this
report.
guy looks like he's been shot here.
Okay, what are
I
you doing?
applied a tourniquet on here. I
Okay,
did
good.
not write the time on there, but it's
That's
only
right.
been about 5 minutes.
Perfect. Okay, what else going on?
We've got an
Any vitals?
open chest wound right here. His respiratory rate is about what did we say? 2?
Yeah, 2.
2 breaths per minute, or 2 breaths
minute.
per minute.
Yeah.
So really low, and this lung is collapsed.
Okay, great man. Thanks a lot.
Carry on.
Appreciate it. Okay, good. So that's important for several reasons right there. Okay, and the important part there was that Robert and I showed up. He gave a brief report, exactly what he saw. He didn't make a diagnosis, right? This is what I did. I did this. This is what I suspect. And you guys carry on, right? You happily turn the scene over, which is important. You don't say, let me sit here and finish. I started this, right?
Yeah.
Turn it over.
Change your evil ways.
That's it. Okay, so let's talk through it. It was safe temporarily, okay? It's a scene where there was a rival gang, okay? He's got the tats, he's got his eyes moving around. I didn't want that rapid eye movement to give you an indication of something else. His
Drug
rapid
use
eye
and
movement
stuff, maybe.
was really looking out for the rest of the rest of the crew because they didn't finish the job.
Gotcha.
Okay, they thought they did, and he was down, but they didn't. Okay. So let's talk through it. What's the first thing you recognized?
After we assessed the scene and stuff like that, first thing I saw was he was bleeding, obviously.
Notice how your attention's drawn the blood
Yeah.
away, right?
Yeah.
Okay. Doing this, and he winced in pain, okay, that told you he's got an upper extremity. I can't fix that with the tourniquet,
Yeah.
all right? And I'm going on down, and the blood loss, once you moved him out of the way, there's significant blood loss on the deck.
Okay.
That's where he's losing most of the blood. So good response, rapid application of tourniquet.
Okay.
Okay. Then come up, PMS is gone, check it, and it's gone, you've done your job. Put up there, sucking chest wound, you picked up on that, put the occlusive dressing on. You thought it did the job because you thought it was only maybe superficial. You didn't really know how deep it was. It's just bleeding, right?
Yeah.
You suspected a sucking chest wound.
It's just good to go ahead and
But
do that.
just go ahead and do it, right? If anything, you're putting a Band-Aid
It's not
on,
a big
right?
deal,
It's
yeah.
not a big deal, right?
Okay.
Okay. Then he was told that he was going to have a hard time breathing. and harder and harder and harder. And what it was that sucking chest wound that you thought was there was actually, yes, it was a sucking chest wound, but it had sealed itself up, and now it does not have an alternative airway.
That's a sucking chest wound. It's a closed.
Now it's kind of closed. That's why it went down slow. 22, 18, 16, 14, 16. Okay.
So just blood clotting and stuff might seal up the hole.
Yeah, and you help to seal it up.
Okay.
Right? Okay. Now, if he was able to breathe naturally, okay, he had been breathing in through his mouth, right, and out through that. So that would have been a good thing to put my head down. Do I hear any air coming out there? If not, then it may be not sufficiently adaptable to that occlusive dressing.
Okay.
But you were ready, right?
What if you didn't have tape? I mean, chances of you have it in that situation, might not have any tape. I mean, I always do because I'm awesome, but not everybody does. So what if he was still coherent enough to slap something like this in there, and I just put your hand on this, man.
Yeah,
keep your hand on that.
If you can put your hand on it,
yeah,
absolutely.
And that'll still kind of serve the same purpose.
Sure, absolutely.
Okay.
Okay, so you got to, if whatever he can do to help you, and if he realizes that you're there to help him, not to finish off the job, he's more than likely going to want to help you.
Got it.
Okay, that's the key, right? Have him do something when he's able to, but he was told to almost go into shock due to blood loss, because he's got a good liter of blood on the ground right now. Fix that problem. Next thing was that issue. The issue was the lungs not functioning correctly. That's when you got out, you found what I had, and all I had was a pen. I take it apart, I'm ready to do it.
Yeah.
But maybe it's got a hole, I can use that. So I don't have to
make a new hole.
Where the new hole is and cause some damage and maybe hit the heart and maybe not get his hands, which wouldn't have been so helpful. So if the patient, if his hands were immobile or something, he's got a big hand, right? Okay. I can't get his hand up there to do that. What do I do?
Just use my hand?
I use my hand and extend it a little bit, right? Okay, it's Jason's hand and my hand, right?
Yeah.
All right? Half-inch bigger than mine. So mine's going to go up there, right there.
Got it.
Half-inch lower than what I would have done myself. So I wanted a radio report, just kind of real quick. I did this, and this. Robert and I showed up as EMS, and you handed over this in.
Got it.
Okay. Just little critical points.
Gang wounds.